Good morning, His Excellencies, the President, West African College of Physicians, Dr. Joe Damilisk, the Chairman, Board of Trustees, Vice Presidents of the College, Presidents of sister colleges, all protocols observed. I welcome you to the 44th and 45th COVID-delayed AGSM. We'll have all wished to be in Banjul physically, but alas. However, this is the very first virtual AGSM of the college with a record number of attendees and abstracts from all over the globe. We have intriguing presentations and symposia and the Maboje lecture this afternoon. We want you to enjoy the virtual Kenny's experience. Kudos to the LOC of the Gambia, led by VP Udwa Kukomo, the WACP ESCO and College Treasurer, and to all staff, and to all you participants and graduates of this AGSM. We want you to enjoy this virtual meeting experience and do join the AGM on Wednesday, the 3rd of November. Thank you all for attending. Stay safe and long live the West African College of Physicians.
His Excellency, the President of the Republic of the Gambia, the Honorable Minister of Health, the College President, Dr. Radcliffe Duro Damil Lisk, Presidents of Sister and Partner College and their officers, Director, Africa Centers for Disease Control and Prevention, Director General, West African Health Organization, Vice Presidents of the West African College of Physicians, past Presidents of the College, President-elect, Dr. Rose Jala Macaulay, Honorable College Treasurer, Dr. Enobong Ikpeme, Secretary General, Dr. Albert Akpalu, Professor Angela Okolo, 2021 Distinguished Mabayeje Lecturer, Fellows and members of the West African College of Physicians, distinguished ladies and gentlemen. On behalf of the Local Organizing Committee of Gambia 2021, I welcome you virtually to the Gambia as we host the first ever virtual annual general and scientific meeting of the West African College of Physicians. I know that we were looking forward to gathering together again in person, but the ongoing COVID-19 global pandemic and surge of its variants has created a situation beyond our control that has made it impractical and impossible for the LOC to hold the meeting in person. The themes for the 44th and 45th AGSM, universal health coverage, a right for everyone everywhere, the role of vaccines in universal health coverage, and destigmatizing mental health in the sub-region are timely. Sustainable Development Goal 3 aspires to ensure healthy lives and promote well-being for all at all ages. It also aims to achieve universal health coverage, provide access to safe and effective medicines and vaccines for all, while supporting research and development for vaccines, as well as expanding access to affordable medicines. In recent years, mental health has stepped out of the shadows and is increasingly being part of the conversation. Yet the stigma of mental health contributes to health disparities and discrimination and continues to permeate all of society, affecting people at all levels. The impact of the current corona disease pandemic on health service provision and utilization, the management of related comorbidities, and the major prevalent public health challenges, including mental health, cannot be overemphasized. Sadly, since the pandemic began, we have lost members, family members, friends, and colleagues. May they rest in peace. 45 years of the West African College of Physicians is a great milestone, and we have remained relevant as a body and repositioning ourselves to the changing dynamics of healthcare, training, and education with our strategic plan cycle in full gear. We strongly feel that to improve healthcare delivery in the sub-region, advance research collaboration and networking, it is pivotal to connect with the global medical community. Our international partnerships continue to grow with excellent and mutually beneficial programs being executed. The virtual format has made the AGSM accessible to more people than ever, And for the first time in the history of our college, we have almost 1,500 members and fellows registered for the AGSM and currently connected to this virtual meeting from across 21 countries of the world. Another first in the history of the college is our virtual induction ceremony, and we congratulate all incoming members and fellows into our prestigious college. We are delighted to observe the growth and nurturing of national colleges and look forward to fruitful deliberations and exchange of ideas and personnel as being demonstrated by the recent addition of the Sierra Leone College. We continue to record growth of our Francophone chapters with WACP membership increasing following the successful holding of scientific and local AGSM in all of them. Truly, we are seeking Franco-Anglophone, Lusophone integration, and this is almost complete. We continue to look forward to further integration of WACP examiners observing and participating in the DS examinations. Faculty chapter activities have been very active with timely and important workshops, symposia, doctors as educators courses organized across the sub-region. Examinations have improved with recognition of the exams procedures and processes, training of examiners, and feedback received from recent questionnaires on improving our exams. And we will continue to improve on our mandate and improve our pass rates. Computerization of our records is almost complete, with digitization of dissertations available on the website and attracting international attention. The college continues to improve and be relevant. Online payment systems, reorganization and restructuring to meet our strategic plans. The LOC and Scientific Committee have worked diligently to make this virtual meeting a rewarding and interactive experience so that we can showcase our important work and continue to learn from and with each other as we meet here virtually over the next few days. Welcome, and we look forward to a successful AGSM. Thank you.
Welcome to the Gambia.
Welcome everybody to the Gambia.
Welcome to the Gambia. Enjoy the conference.
Welcome to the Gambia. Enjoy the conference.
Welcome to the Gambia, the smiling coast of Africa.
Welcome to the Gambia, the smiling coast of Africa.
A warm welcome to the Gambia.
Welcome to the Gambia.
You're welcome to the Gambia.
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 Welcome to the Gambia, the smiling coast of Africa.
Bienvenue. Welcome to the Gambia.
Welcome to the Gambia.
I take great pleasure in welcoming you all virtually to the smiling coast of the Gambia.
Welcome to the Gambia.
Welcome to the Gambia.
Your Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, Honorable Cabinet Ministers, Honorable National Assembly Members, President, West African College of Physicians, Presidents of sister and partner colleges and their officers, Director, Africa Centers for Disease Control and Prevention, Director General, West African Health Organization, Vice Presidents of the West African College of Physicians, past Presidents of the College, President-elect West African College of Physicians, Honorary College Treasurer, Secretary General of the College, distinguished Mabayoje Lecturer, Fellows and members of the West African College of Physicians, distinguished guests, ladies and gentlemen. On behalf of the Republic of the Gambia, and particularly the Ministry of Health, I am delighted to welcome you all to the 44th and 45th Annual General and Scientific Meetings of the West African College of Physicians, hosted by the local chapter, the Gambia. I'm particularly delighted that the Gambia has recently been able to commence in-country postgraduate medical training in the specialties of pediatrics, internal medicine and family medicine, in addition to obstetrics and gynecology and surgery, with support from the World Bank and other partners. We are most grateful to the WACP's commitment to the Gambia chapter related to the postgraduate medical education, particularly in providing the structure and the content of the training, as well as waiving primary examination fees for intending trainees from the Gambia for a period of 3 years, from 2018 to 2020. Over this period, 29 out of 65 candidates, that's 45%, that sat for the examinations were successful and will form the first cohort of physicians in training. We further note that the Gambia is a constituent member of the West African College of Physicians that serves as a health policy advisor in the West African sub-region, and that some of its members provide the same service for their respective countries. We are reminded that the annual general and scientific meetings of the college are the largest gathering of physicians and specialists in West Africa and are rotated among its 14 member nations. We are therefore glad that the 44th and 45th AGSMs are being hosted by the Gambia chapter, even though virtually due to the COVID-19 pandemic. Our West African sub-region is still dominated by high prevalence of communicable and non-communicable diseases, weak and fragmented health systems, thus exposing the sub-region to significant health challenges despite the multitude of stakeholders active in healthcare delivery. Although the Gambia has an excellent coverage of EPI vaccines, we cannot rest on our oars in the fight against all vaccine-preventable diseases. Rollout and uptake of COVID-19 vaccines has been good, but like all low and middle-income countries, we are unable to boast of high vaccine coverage among our adult and at-risk populations. The theme for this year's AGSM is Universal Health Coverage, a right for everyone, everywhere, with the following sub-themes. 1. Destigmatizing mental health in the sub-region, and 2. Role of vaccines in universal health coverage. We sincerely hope that your deliberations will help address some of the policy and implementation issues at stake within the selected themes and sub-themes. Please enjoy the next 3 days of your AGSM and networking. Once more, you are most welcome to the 44th and 45th Annual General and Scientific Meetings of the West African College of Physicians. Thank you for your kind participation.
Thank you for the opportunity you provided Africa CDC to present at this very important meeting, that is the Annual General and Scientific Meeting of the West African College of Physicians. Let me start by congratulating the organizers for putting together such a state-of-the-art meeting, especially during this very critical period of the pandemic, that is the COVID-19. I was asked to share with you Africa CDC's COVID-19 response, and in the next couple of minutes, I'm going to share with you lessons we've learned and how Africa's CDC has responded to the COVID-19 pandemic since it started, and then conclude with some key takeaway messages. So let's start with some lessons learned and what Africa's CDC has done so far. The past 18 months have been both challenging, but have offered a unique opportunity for the African continent to battle against the COVID-19 pandemic with expressed solidarity and greater cooperation. There are a couple of lessons that have emerged, and we've listed some of them here, but not all of them. And I'll just leave it on the screen for a few minutes for you to look at that. And then what I'll do is to walk you through these key lessons one by one. So let's start with lesson number one. Very critical to our success has been the important role of political leadership and cooperation within the African Union. If you recall, when COVID-19 first was reported on the continent on 14th of February 2020, the chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, convened a meeting of all ministers of health, and you can see them here, where we developed a roadmap and a strategy, what is commonly called the Joint Continental Strategy for COVID-19 Response in Africa. That strategy was underpinned by the need to coordinate and collaborate our activities in the spirit of the whole of Africa approach. And as I indicated earlier, a joint continental strategy was developed and has since been adopted on the 8th of May by the ministers of health, who met after reviewing critically what has happened over the last 1 year, decided to adopt a strategy that is now underpinned by the need for enhanced prevention, enhanced monitoring, and enhanced treatment. As I stated earlier, our success has been driven by the 4 C's: the need to coordinate our efforts, to cooperate, to collaborate, and to communicate effectively under the very capable coordinating body, the Task Force for COVID-19 Response, AFCOT, which was established at the start of the pandemic. Lesson number 2 is the critical role of national public health institutes. The likes of Nigeria's CDC, the Uganda CDC, the Ethiopian National Public Health Institute, and others have been extremely important in our ability to fight and coordinate our efforts to this pandemic. Under this very important mission, the lesson number 3 has been for the need for Africa CDC and the relevance to develop what we call continent-specific guidelines. We've developed over 50 guidelines documents in several areas, and some of them are indicated on this slide. Lesson number 4 has been the political commitment, where, as I indicated earlier, ministers of health met on the 8th of May and decided that it was time to adapt our strategy. And you can see President Tshisekedi as the chair of the African Union, President Ramaphosa, the champion for COVID-19, and Chairperson Musa Faki Mahamat. Lesson number 5, that we need to focus on local manufacturing of both what we call response commodities, including diagnostics. When this pandemic first hit, if you look at this curve very carefully, the continent of Africa literally had no diagnostics. We had to advocate, make the right noises, and wrote papers, commentaries in Nature and others in order to stimulate the world to pay attention to our needs. This map is, at times, when I show it, I'm very proud of it, but at times I'm also very nervous. In January of 2020, if COVID had hit the continent, there was absolutely no laboratory or no country that had the reagents to test for COVID on the continent. In February, we started training workshops in Senegal and South Africa, where we brought countries together and armed them with the ability to test. And I'm very pleased to see that as of today, all countries in Africa now have the capacity to test for COVID-19. Lesson number 6 is that we need also to focus on the ability for the continent to manufacture vaccines. If you look at this picture carefully, it shows you that on your left-hand side, that as a continent, we import 99% of our vaccines and only produce 1% of the vaccines. At the bottom there, it shows you a commentary from the Economic magazine. It says COVID-19 has exposed Africa's dependence on vaccines from abroad. Now, if you look at your right-hand side, it shows you the very limited number of people that have received full vaccination in Africa. That is absolutely not good for our health security, and that scenario must change. It is in that spirit that head of states, when I presented to them last August, we agreed on the need to have a joint strategy for vaccine development and access on the continent. You can see on the top right-hand side, the top panel there, President Kenyatta from Kenya, President of Mozambique, President Kagame, and there were a series of other presidents there. Since then, the situation is improving. I'm pleased to say that we hosted a very important vaccine summit on the 12th and 13th of April this year, and we brought together 40,000 participants from 70 countries to discuss the need for us to manufacture vaccines on the continent. At the end of that summit, President Tshisekedi, in his capacity as the chair of the African Union, launched the Partnership for African Vaccine Manufacturing, which has now become the framework for us to manufacture vaccines, especially to shift the target and make sure that instead of importing 99% of our vaccines, we manufacture 60% of our vaccines by the year 2040. At that summit, President Kagame said this, and I'll quote, "Vaccine inequity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products," end of quote. Lesson number 7, that local manufacturing of personal protective equipment, therapeutics, and medical equipment is a health security challenge. This slide shows you clearly the challenges we faced at the start of the pandemic, where we were in shortage of so many things, including oxygen. And that situation has to change if we have to better prepare ourselves for future pandemics. Lesson number 8 is clearly the need for us to develop urgently an African public health workforce agenda. We are calling for the continent to focus on the development of the African Epidemic Service, which will be an elite workforce focused in 3 areas: the Field Epidemiology Training Program, the Laboratory Leadership Program, and the Public Health Informatics Program. Just to put that in context, as a continent of 1.2 billion people, we need 6,000 epidemiologists. We only have about 1,900, so there's clearly a gap there. We need frontline epidemiologists, about 25,000 of those, and we currently only have about 5,000. So there's a clear gap there of about 20,000. So we need to close that gap. And community healthcare workers are so important, and we are in acute need of that. We also need public health leadership, and that is why we launched in the middle of this pandemic the Kofi Annan Global Health Leadership Fellowship Program. And I'm very pleased to announce that the first cohort is on the way, a cohort of at least 20 candidates from across the continent. And it has actually received a lot of strong faculty from across the world who engage with these participants to actually enable them and enhance their public health leadership skills. Some key initiatives have emerged over the course of the last close to 2 years with respect to the COVID response in Africa. I indicated a joint continental strategy which developed the partnership to accelerate COVID testing, the COVID response fund, the African Medicine Supply Platform, the Task Force for COVID-19 Response. We also have the Vaccine Delivery, Development and Access Strategy, which has developed the AVAT, which is the African Vaccine Acquisition Task Team, the African Vaccine Delivery Alliance, and the Partnership for Vaccine Manufacturing, which I discussed earlier. This slide shows you some of the swap teams that we have been putting in countries, in Zambia, in Namibia. And overall, we've deployed rapid responders, 230 rapid responders in 25 countries, deployed over 18,000 community workers in 28 countries as of September. We also have, as I said earlier, have a platform. You can just pull out your phone and Google amsp.africa. You see a platform that will appear, which is a platform that we have that is helping us to coordinate commodities across the continent. The Trusted Travel Platform was established on October the 8th, and which is now becoming a continental platform to manage ability to travel across the continent, as well as the vaccination issues. Now, let me just focus on the vaccines and vaccination situation on the continent. At Africa CDC, we have a simple formula that says vaccines plus vaccinations equals life saves. As a continent, we have established a target that in order to control this pandemic on the continent, we need 60% of the population to be vaccinated. That will require 800 million people to be fully vaccinated, and as such, requiring 1.6 billion doses of vaccines. If you just keep that formula in mind, that is very importantly that we need 1.6 billion doses of vaccines to achieve 60% coverage. The COVAX mechanism had agreed earlier on that they would provide us with 26% of our needs. That translates to about 350 million people fully vaccinated. Harvard has reached out and signed contracts with Johnson & Johnson and is now capable of providing vaccinations to over 400 million people, but we still have a gap. You now know that WHO has now said we need to vaccinate at least 70% of our population. But where are we on the continent? This graph shows you the staggering reality that countries like China have vaccinated almost 76% of its population, United States 63%, Europe about 56%, India 44%, and the rest of the world 44%. But as a continent, we have only vaccinated about 6% of our population that is either fully vaccinated or partially vaccinated. So where are some of the gaps we see? So as of October 4th, the continent had acquired about 200 million doses of vaccines. Of those, 156 million have been administered, representing 76% of the doses available being administered, and that is coming from 53 member states. A total of 4.57% of our population is now fully vaccinated. Some countries are making good progress, like Morocco is around 53% vaccination, Mauritius 61%, Seychelles 71%, South Africa 16%. Again, the vision for African vaccine manufacturing is simple: to ensure that Africa has timely access to vaccines to protect public health security by establishing a sustainable vaccine development and manufacturing ecosystem in Africa. The Harvard mechanism was put together by President Ramaphosa and has now become a regional mechanism that has been playing a critical role for us to acquire the 400 million doses of vaccines. And these vaccines are beginning to arrive countries in Cameroon, Togo, Botswana, and other countries have received their vaccines, including Ethiopia. This slide shows you the airport ceremony where I was there with Minister Leah to distribute the vaccines or receive vaccines that had arrived. Other countries like Lesotho, Nigeria, Zambia have also received their vaccines. I just want to be sure that vaccines save lives. As we said in our formula, vaccines plus vaccination equals life save. The graph you see here is borrowed from the United States CDC, and it shows you in the red line that most deaths occur, 99.2% of the deaths occur in June of this year amongst unvaccinated people. That is people who have been infected with COVID, but they subsequently died, unfortunately. So we are making progress on the continent with respect to COVID vaccination and production. And several countries that are listed here, including Senegal, Morocco, South Africa, Egypt, and Algeria, have all engaged in the process. And Rwanda, I'll add here as well, it's Nigeria, Uganda, have all engaged in the journey for vaccine production. And some of the partnerships have been published in Financial Times. I will not go into the details here. And just to conclude by saying that we are very fortunate that a partnership was established between the Africa CDC and the MasterCard Foundation.
I welcome all of you as pioneers of this unique experience of our college. By this I mean participating in the very first fully virtual annual general and scientific meeting of the West African College of Physicians. This has been forced upon us by prevailing circumstances of the COVID-19 pandemic. For the same reason, we had to suspend our meeting in 2020, which should have been held in the Gambia. But thanks to technology, we are now gathered, albeit virtually, to witness and participate in this conference. The West African College of Physicians, in spite of difficult situations worldwide, continues to progress and pursue its aims and objectives. Training specialists in the 6 faculties of community medicine, internal medicine, family medicine, pediatrics, laboratory medicine, and psychiatry remain our primary aim, and we have maintained our update and revision courses virtually. We have now introduced computer-based testing, CBT, for primary and membership examinations, and this has been successfully carried out in the last 2 examinations. The West African College of Physicians must grow both in terms of infrastructure as well as its human resource. Our brand new headquarters in Abuja, consisting of a completed conference center, and it sits over 1,000 and also used for examination purposes, and a tower block of 6 stories, which is incomplete and now the focus of fundraising drive to which we expect every fellow and member to contribute. Once completed, this will be a source of income to the college and reduce our dependency on examination fees and annual subscriptions of fellows. I am therefore urging all of you to pay up. In terms of human resource growth, college must expand its fellowship base to include suitably qualified colleagues outside the sub-region to enrich our faculties. This is a win-win situation whereby our brothers and sisters abroad will have the opportunity to establish links with our institutions where many of them trained. And we, in turn, will also benefit from their expertise and contribution to the training of our residents. For this and many other reasons, we have now set up a Constitution Review Committee under the able leadership of Dr. Olufemi Ogumbi to bring our Constitution up to date to meet the prevailing aspirations of college. College continues to strengthen its administrative structure, and for the first time, we now have a very well qualified head of administration who has helped to restructure the secretariat, and we have appointed a French-speaking administrator and human resource officer, as well as a full-time IT specialist. This will vastly improve the efficiency of our college and cater to the needs of our Francophone colleagues. Finally, I must heap praise and thanks to the Gambian chapter for pioneering this very first virtual AGSM of college. Particular mention is due to Dr. Uduak Okomo, Chair of the Gambian chapter and Vice President of college, whose vision and dogged persistence, a refusal to take no for an answer, resulted in the realization of this meeting. The themes and symposium cover a vast array of current issues, including COVID-19, vaccinology, universal health, and mental health. Et pour nos collègues francophones, soyez les bienvenus. Je vous prie de bien vouloir participer à tous les événements parce que cette séance est vraiment bilingue. Merci and thank you all.
President West African College of Physicians, President of sister and partner colleges and their officers, Director Africa Centers for Disease Control and Prevention, Director General, West African Health Organization, Vice President of the West African College of Physicians, past presidents of the college, President-elect, West African College of Physicians, Honorary College Treasurer, Secretary General of the College, Distinguished Mabayabo Lecturer, Fellows and members of the West African College of Physicians, distinguished guests, ladies and gentlemen. On behalf of the government and the people of the Republic of the Gambia, I am pleased to welcome you all to the 44th and 45th Annual General and Scientific Meetings of the West African College of Physicians. The Gambia, the smiling coast of Africa, with its unique warmth and friendship, has a well-known record of hosting the annual general and scientific meetings of the college. The country is a much-loved destination for physicians across the West African sub-region, not only to examine and discuss scientific and professional matters, but also to relax and enjoy what we have to offer. Unfortunately, the ongoing global COVID-19 pandemic and its variants has made it unsafe for the college to hold its face-to-face meetings for 2 years in a row. It is my hope that whenever we get over these difficult times, we will come more often to the Gambia on both official and private visits. I am informed that the AGSMs of your college bring together the largest number of physicians and specialists in West Africa. It is thoughtful that the meetings are rotated among its 14 member nations. Hence, the Gambia chapter is hosting the 44th and 45th virtual meetings. Noting the importance of your annual meetings, I am happy to be accorded the honor of participating in this opening ceremony, which has been made possible through the effective partnerships that bind the government of the Gambia, the college, the Gambia chapter, and our partners and sponsors. I must say with honesty that when we were requested to host the AGSMs virtually, we had doubts about our ability to manage such events at this stage in the development of our nation. Today, I am confident that we can host any meeting if we plan well and have the support we need. For this reason, I thank the chairperson of the Gambian chapter and college vice president, as well as the local organizing committee for working hard during the past few months to set the stage for these crucial meetings. I also appreciate more sincerely the hard work of the college, whose objective is to raise the portfolio of universal health coverage within the sub-region. As the theme of your conference suggests, universal health coverage is indeed a right for everyone, everywhere. I am happy to announce that with the support of our partners and friends, the Gambia has been able to strengthen healthcare delivery in the face of the COVID-19 pandemic. The Essential Health Services Strengthening Project will provide performance-based financing grants to health facilities, scale up community engagement to improve quality health services, and build strong and sustainable health systems to support the delivery of health services. The project includes renovating selected health facilities and establishing a national blood transfusion service. With all this in view, it is both an honor and a pleasure for my country, the Gambia, to have been asked to host the fourth virtual annual general and scientific meetings of the West African College of Physicians. We are delighted to be associated with such innovative undertakings and will continue to support your work. College President, distinguished ladies and gentlemen, I have noted that you have a long list of items on your agenda to cover. Without further delay, and to set the conference in motion, it is now my pleasure to declare the 44th and 45th Annual General and Scientific Virtual Meetings officially open. I wish you fruitful deliberations and thank you for your attention.